Hello friends, how are you all? I hope you all are fabulous. And today we are going to talk about another CAPA tool, that is root cause analysis. So far we discussed process mapping, the brainstorming, 5 whys method, and SWOT analysis, strength, weaknesses, opportunities and threats. So today this is our topic, root cause analysis or cause and effect analysis. So first of all, I'll define the root cause analysis. Root cause analysis is a method to identify the problem and gather its data and find out the potential source of the infection. So there are certain steps to find out the root cause, analyze it and go for the solution, for the preventive action and the corrective actions. So as I work in the post-operative area, so I can relate it with some examples of post-operative infections, post-operative infection control method. So by RCA, root cause analysis method, first of all we will identify the problems, then gather the data regarding the patients, its name, types of surgery, date of surgery, duration of staying in the hospital, what all antibiotics or what all the procedures occurred in the hospitals. So all these comes under the gathering data. Then third is the identify the problems like the infection, post-operative infection. Then the next one is analyze the infection, analyze the whatever the happened, like I am talking about the post-operative infection. So analyze. So what will comes under the analyze? Go for the potential source of infection, the date of the surgery, find out the hand hygiene. You must be noticed that someone comes from outside and immediately go to the patients and expose the dressings and started to do the dressings, isn't it, in our department? So you must have to notice and find out and check them, tell them not to do that, go for the hand hygiene and then wear gloves and then touch the operative site. If we will be aware about it, then definitely we can check, we can reduce the post-operative infection. Then go for the surgical site. Then we check for the sterilization process, whether the sterilization process is proper or not. Then after that we will go for the training and compliance, that our resources, our human resources, like I am talking about especially for the doctors and us nursing officers, whether we are proper trained or not. Actually we are trained here, but we are not talking about this institution only. This is overall. We should know the way, the process, the hand hygiene technique, the proper wound care, the proper dressing, the dressing materials. We should find out its efficacy, whether it is proper sterilized or not. So these are some steps by which we can analyze, we can find out the root cause of the process, and we can we analyze the root cause and then we will go for the solutions. So what will be the solutions? Once we will identify the root cause, its cause, then there will be very easy to find out the solution. We will go for the antibiotic and the proper dressings, the hand hygiene and the proper wound care, post operative dressings, and we will search the proper soakage after the surgery. So these are some measures by which we will definitely reduce the infection and reduce the source of infection, reduce its consequences. So this is the one example. Another example you can take for other things, like in our department, if mosquitoes are flying, we have seen, then what we will do? We will inform to the pest control department and for the PWD to get the spray done. So this is under the corrective measure. And if we are aware enough, we haven't seen any mosquitoes, cockroaches or the rats, and weekly or fortnightly, if we will inform the PWD department, we are aware enough for the pest control, for the spray, then these will come under the preventive measure. So as we all know, CAPA means what? CAPA means corrective and preventive. So for both the measures we should go, and we can prevent the lack, and we can improve the patient care, the quality care to the patients. So you can correlate this CAPA tool according to your concerned department, and you can apply in your department, and you will improve, definitely you will improve the quality care to the patients. We can reduce our stress of the working force, stress of the subordinate staffs, and in this way our atmosphere will be smooth, and we will be strong enough, efficient enough to provide the quality care to the patients, to our subordinate. Thank you and have a great day.